My name is Norleis Nieto, and my company Jenny Igita. We will present a guidelines of clinical practice for the management of swallowing disorder. Healthcare workers perform procedures close to the respiratory tract face a risk of a COVID-19 contamination. All patients should be considered potentially infected. Precaution depend on the time of procedure, not the patient's COVID-19 status. Procedures with a high risk of contamination included endoscopic pharyngolaryngologics, evaluation, and video fluoroscopic swallowing examination. Voice rehabilitation is not urgent. It is recommended that the teleconsultation are preferred over face-to-face evaluation. Um, Recommendation focus on the management of swallowing disorder and reset dysphonic, limiting face-to-face section to a specific case after team discussion. Like author Karen Burns, otolaryngologist and speech language pathologist must provide the best care to the population and prevent the spread for COVID-19. It is important to assess the risks to the patients and the healthcare professional and age situation. For general practice, the recommendation of the French Society of Otolaryngologists should be followed, especially on the technique and precaution in nasoendoscopy and laryngoscopy. Documents from the French government, the French High Colwyn of Public Health, and the French Society of Hospital Hygiene should also be consulted. These documents provide recommendations that may change as the epidemic and recession progresses. Procedures involving close contact with the respiratory tract have a high risk for COVID-19 transmission, especially when coughing and spitting are present. Speech therapy is therefore considered urgent to focus on treating swallowing problems and recent this point. Speech therapy and be continued remotely during confinement in French. Precaution for fluoroscopy following examination are being evaluated.
Key points. Voice and rehabilitation is not considered urgent during the recurrent epidemic. If treatment has already begun, it may be continued via telerehabilitation. Current recommendations focus mainly on the management of swallowing disorder and assessment of acute dysphonia. A asymptomatic patient might still be infected and contagious and false negatives in COVID-19 testing are common. Therefore, the same precautions must be applied to all patients. Certain procedures pose a high risk of exposure for healthcare workers, including clinical and flexible endoscopy, swallowing assessment, flexible endoscopy, nasogastric tube insertion, and biofluoroscopy swallowing studies. Recommendations for the assessment of patients with recent onset dysphonia. Laryngologists and speech language pathologists may need to perform flexible nasendoscopy or laryngoscopy to assess case of recent onset dysphonia. One, teleconsultation is preferred whenever possible. Two, in low risk case, where flexible endoscopy is not required, but the patient and healthcare provider so wear surgical masks during in-person consultations. And three, when flexible endoscopy is necessary for airborne PPA must be used at cap, FFP2 masks, protective goggles, or face shield in gloves, and now go on. Recommendations for the assessment of patient with swallowing disorders. Swallowing assessment should only be performed in urgent and notifiable case. The addition to process-wide in-person evaluation should be based on interdisciplinary team discussion. Most assessment can be postponed until the patient is no longer considered contagious. Teleconsultation is recommended when appropriate and the technical feasible. Video fluoroscopy swallowing students require full personal protective equipment and PPA, similar to that used for airway procedures. If fall or liquid aspiration is suspect, to examine should be daily unit. The patient is no longer contagious. If oral feeding is not possible alternative methods of nutrition so be discussed and implemented. Interior and renewal of nasogastric tube must to perform by the same protected protocols as airway procedures involving the minimum necessary personnel. COVID status of patients. In the context of the pandemic, it is assumed that any patient could be COVID positive, even if there's no symptoms. Patients confirmed to be COVID positive include those who have one positive PCR test, two chest CT scan is knowing one abnormalities, three typical of COVID-19. Suspect COVID case include patients who patients typical symptoms such as fever, cold, fatigue, muscle ache, and loss of smell or taste, digestive issues like diarrhea or confusion. Have a close contact with a confirmed COVID case. However, it's important to remember that not all COVID positive patients know symptoms. Lasted treating patient while wallowing disorders is the considered high risk for virus transmission, since the producers can generate respiratory droplets.